Stop right now. If you're pregnant and still using prescription retinoids or aggressive chemical peels, it is time to hit pause. Topical retinoids, including over-the-counter retinol and prescription tretinoin, these are strictly contraindicated in pregnancy. Reviews in dermatology consistently recommend avoiding all retinoids during gestation. And while most skincare ingredients have minimal absorption, retinoids and hydroquinone, which is highly absorbed, remain two of the major skincare ingredients that we say no to. So it's safest is to stay away from them during pregnancy. Hi, I'm Dr. Mamina Oregano, a triple board certified dermatologist, mom to be, well, second go around, and skin health geek. Pregnancy has turned my anti-aging routine upside down, and I am here to share science-backed swaps so that you can keep glowing safely. In this video, I will cover what to ditch, what to keep, and how to focus on longevity in your skin even during pregnancy. You'll hear about recent dermatology studies and expert guidelines so you know each tip is evidence-based. By the end, you'll know exactly which ingredients to avoid, which to favor, and how lifestyle tweaks, think diet, sleep, stress, can also feed into healthy skin aging. Pregnancy skin changes and why your routine matters. So pregnancy floods your body with hormones and your skin responds to all of that. So about 20% of pregnant women can develop melasma, which is a hyperpigmentation condition. It's also known as the mask of pregnancy, where you get these patchy brown spots from estrogen and progesterone surges. And many also see new acne or oiliness because of the higher androgens. And yes, you can even see a slight uptick in wrinkles or skin laxity due to stress and collagen changes. So in one 2024 survey of 337 expectant mothers, around 3% reported worsening hyperpigmentation, hair loss, cellulite, and even more fine lines during pregnancy. Yet surprisingly, only about 17% of those women regularly used sunscreen. This is a glaring missed opportunity. This matters because UV light not only triggers melasma, making your brown spots even darker, but it can also drive skin aging and of course skin cancer. And in fact, UV exposure is linked to 80 to 90% of non-melanoma skin cancers, and sunscreen use has been shown to reduce melanoma and photoaging. Put simply, your pregnancy is the perfect time to prioritize photoprotection and gentle, effective skincare. Unlike normal skincare routines, we will choose ingredients that are proven to be safe for the baby and beneficial for long-term skin health. Safe versus unsafe ingredients. Ingredients to stop using. So retinoids, you want to stop using all vitamin A derivatives, retinol, tretinoin, adapalene, tazarotene, retin-A, Tazorac. They can accumulate in fetal tissue and are associated with birth defects in animal studies. Dermatologists categorize them as unsafe in pregnancy, so you want to swap those out completely. And then there's Accutane or isotretinoin, which is an oral retinoid used to treat acne, severe acne. That is definitely contraindicated during pregnancy. That has been shown to cause birth defects in human babies. Next ingredient to avoid is hydroquinone. This is commonly used for melasma, but hydroquinone is highly absorbed. About 35 to 45% can be absorbed through the skin. And although one small study didn't show birth defects, experts still advise avoiding it because of its really heavy absorption and minimal studies. Then there's strong exfoliating acids. So high dose salicylic acid peels or aggressive chemical peels with trichloroacetic acid or high strength glycolic acid. Those are best to be avoided. Now, lower concentration salicylic acid cleansers like under 2% are fine, or glycolic acid under 10%, and I'll get more into this later in the video. So other cautions, I would be wary of certain essential oils or phthalates. I just would say it's safe to stick to fragrance-free and dye-free products. And I don't want to dismiss all fragrances or all essential oils because some are definitely safe, but it's sometimes hard to avoid the ones that aren't safe. You just don't know. There's so many different essential oils and fragrances out there. So I would just say it's safest to avoid them altogether. So I just say that I find it easy enough to minimize exposure by avoiding the use of these altogether. Please avoid tanning beds entirely. Next, ingredients you can keep or even add. So first we have vitamin C. It comes in different forms like L-ascorbic acid, THD ascorbate. There's other forms out there. This is a powerful antioxidant and collagen booster. Topical vitamin C is considered safe in pregnancy. It doesn't really reach high blood levels and it can help brighten your skin and even out skin tone as well. Many dermatologists recommend getting a 10 to 20% vitamin C serum for pregnant patients, especially if you use retinol pre-pregnancy and you still want to maintain a good anti-aging routine. Next, we have niacinamide, which is a vitamin B3 derivative. Niacinamide can calm inflammation. It can support your skin barrier. It can even out your skin tone. It does a lot. It wears a lot of hats. We love a good niacinamide. At higher concentrations, it can help your pores. Vitamin E is an antioxidant, and a recent review specifically notes that niacinamide and vitamin E as safe, pregnancy-friendly brighteners for melasma. Hyaluronic acid. So this is a hydrating ingredient. It can hold water in the skin and it's safe. It's a large molecule that doesn't penetrate the body. You want to use a good hyaluronic acid serum or moisturizer to plump those fine lines and keep your skin looking supple. Part of me also thinks that hyaluronic acid is kind of an overhyped ingredient because, first of all, it's in so many moisturizers already, along with glycerin, which is another amazing humectant that doesn't get talked about a lot. There's other like wonderful hydrating ingredients out there as well, like snail mucin and polyglutamic acid. I think that hyaluronic acid's just gotten really, really popular. But like I said, it's an easy thing. It doesn't increase collagen production like vitamin C or certain peptides or like retinols. You can't use retinols, but it can increase the hydration in your skin, which is important because your skin does get more dry during pregnancy, and increased hydration can hide some of the wrinkles in your skin. So I mentioned peptides. So collagen boosting peptides like copper peptides or palmitoyl peptides, Matrixyl 3000. These are generally considered safe alternatives to retinoids as they stimulate collagen production without known fetal risk. So far, there's no data on topical peptides and pregnancy harm, so no red flags there. So then there's bakuchiol. This is a plant-derived retinol alternative. It does not replace your retinol, but it can still have some of the same benefits. It's been shown to improve fine lines, pigmentation, elasticity without the irritation of retinoids. And of course, unlike prescription retinoids or over-the-counter retinol, bakuchiol does not have those known teratogenic risks and is generally considered safe for use during pregnancy. This is a great option if you want retinol-like benefits without the safety concerns. Next are alpha hydroxy acids or AHAs. These include things like glycolic acid, lactic acid, mandelic acid, and at low to moderate strengths, these are acceptable. Studies do show that high-dose glycolic acid can cause problems in animals only, and these are like at massive doses. At normal cosmetic levels, it really should not be a concern during pregnancy. But like I say, just to be safe in practice, you can use light alpha hydroxy acid peels or glycolic acid toners for gentle exfoliation. Stick to mild at-home peels, not those in-office high-strength peels. And I would say to be super safe, stick to under like 10% when it comes to glycolic acid. Next, we have azelaic acid. This one is beloved by many dermatologists. This is a safe prescription and over-the-counter option for acne and hyperpigmentation. So azelaic acid comes in between like 10 to 20%, 10% over-the-counter, 15 to 20% prescription. It's minimally absorbed, only about 4 to 8% is absorbed. And importantly, no fetal harm has been reported and dermatologists consider it safe any trimester. We like azelaic acid because it can do a lot. It can reduce pigmentation, it can reduce redness and inflammation, and it's a good retinoid alternative when it comes to treating acne during pregnancy. Next, we have benzoyl peroxide. So in general, this is considered safe for acne. Only about 5% is absorbed and it's quickly turned into the inactive benzoic acid. There has been no evidence of harm in pregnancy. I would say to be super safe, use between 2 to 5% in strength and just a small spot treatment if needed. Next, we have physical or mineral sunscreens. So mineral sunscreens which contain zinc oxide or titanium dioxide are the first choice for pregnant women. They can still be absorbed, but not as much as chemical sunscreens. And I'm saying that chemical sunscreens aren't bad either. If you're using one, it's probably fine. I just say that if you want to play it super safe to use mineral sunscreens because there's definitely a higher absorption with chemical sunscreens. Like I said, it's been fine, like no major fetal harm, but it's like if you're going to use a sunscreen, you might as well use one that has less absorption into your bloodstream, right? Now, mineral sunscreens, do have its downsides. It can make you look more like a ghost and it's more annoying to put on. It's not as elegant as a chemical sunscreen. So ultimately it's a personal decision. But regardless, when you are using sunscreen, I do recommend a minimum of SPF 30 or higher daily, even if you're indoors all day, and to remember to reapply, especially if you're going to be outdoors. I'm especially a fan of tinted sunscreens. So those sunscreens contain something called iron oxides, which give extra protection against visible light and also can help camouflage your melasma as well as protect your melasma. Okay, to summarize, let's do a quick list to say what's safe and what's not safe. So what's safe? Vitamin C, niacinamide, vitamin E, hyaluronic acid, peptides, azelaic acid, mild alpha hydroxy acids, benzoyl peroxide, and mineral sunscreens. What to avoid? Retinoids, including retinol, tretinoin, retinal, adapalene, hydroquinone, high-dose salicylic acid, glycolic acid, TCA peels. And then we also talked about essential oils and phthalates. Sunscreen and UV protection, your #1 anti-aging strategy. Never skip SPF. Every day, even on cloudy days. UV light is the ultimate skin aging toxin, causing wrinkles, uneven pigment, and yes, skin cancer. Broad spectrum sunscreen, SPF 30 or higher, dramatically reduces the risk of both squamous and basal cell carcinomas as well as melanoma. This is doubly important in pregnancy because sun can definitely trigger melasma. Studies show that frequent sun protection prevents and lightens the that mask of pregnancy. One clinic review emphasizes that using sunscreen mitigates melasma flare-ups and helps keep your skin stable. For safety, I just say I favor mineral or physical sunscreens. New research explains that titanium dioxide and zinc oxide have less absorption and no endocrine disruption. And like I said earlier, chemical sunscreens have been found to be safe in humans. No harm has been found to be in fetuses, but at extremely high doses, it has been shown to cause issues in non-human models. And so, like I said, if you just want to play it super, super safe, use mineral sunscreen, but ultimately I think it's up to you. Now, if you have darker skin or melasma, like I said, those mineral sunscreens aren't as elegant. They can make you look like a ghost or make your skin look more gray. So I would play around with different shades of tinted mineral sunscreens. They have so many more options out there with tints that cover a very wide spectrum, thankfully, finally. So you may have to go somewhere to like try out different tints, or sometimes certain companies will send you different samples to try different tints. And don't forget, beyond sunscreen, there's also things like sun protective clothing, which makes things so much easier, honestly, when it comes to like your arms or body. And then also big hats, sunglasses. Sunscreen itself is not 100%. Lifestyle and longevity. Nourish your skin from within. So anti-aging, of course, isn't just about creams. It's a whole body approach. And my passion is longevity. So here are some lifestyle tweaks backed by science that you can do during pregnancy and also beyond pregnancy. You want to focus on antioxidant-rich foods, load up on fruits, vegetables, whole grains, lean proteins. We're talking salmon, nuts, beans. These can provide vitamins like vitamin C, E, carotenoids that can fight oxidative stress. Always easier said than done. Avoid excessive sugar and ultra-processed foods, which can drive advanced glycation end products or AGEs in your body. These high AGE diets can also spike oxidative stress and inflammation. This is bad news for your collagen and pregnancy health. This is such like tough advice because as somebody who's currently pregnant, it's like sometimes the cravings are maddening. Like I feel like there's a parasite living in my body and like I'm complete slave to this parasite. It's like, drink bubble tea right now. Okay, get froyo right now. Okay. So you got to listen to your body, but yes, really try to focus. I try to like when I'm craving something sweet, I'm like, I'm just trying to reach for the fruit. But yeah, these cravings can be insane during pregnancy. So I feel yeah, okay, it's hard. It's hard sometimes to control what you eat. But anyways, when it comes to like low sugar foods, very well balanced foods that are good for your skin, think things like salmon, sardines, spinach, berries, colorful vegetables, plenty of water. So omega-3 fatty acids, I mentioned salmon. These are found in fish oil, flaxseed, and omega-3s can really help your skin barrier function better. It can increase hydration in your skin and can reduce inflammation. And when I say hydration, like it's a fatty acid that nourishes your skin cells better. So it just feels like moisturization is better in your skin. Of course, it's also so crucial for your baby's brain development. We know that a healthy mom makes for a healthier baby and future longevity. So get those omega-3s in, the DHAs, EPAs. I also like choline for brain development too. Another super important thing to do while pregnant, sleep. So you're going to strive for 7 to 9 hours. Might be impossible, but strive. Pregnancy hormones can often disrupt sleep. I'm feeling that now. And of course, chronic lack of sleep can spike certain inflammatory markers. And these can include hormones that break down collagen and speed up aging. So obviously try to prioritize rest, just nap when you can. Creating like a nice, relaxing, soothing bedtime routine as well is helpful. Research has linked insufficient maternal sleep to longer-term health risks, so it is worth it. Stress management. So cortisol from stress is an age accelerator for skin. Gosh, I feel like if you watch my videos, you probably feel like I sound like a broken record. I'm repeating a lot of the same things. Getting back to stress. Things that can help combat stress, meditation, gentle prenatal yoga, which I have been loving, or even short walks can help keep stress hormones in check. You know, stress is not really good for baby development. Stress, we also know, has been shown to cause a variety of skin issues, eczema, rosacea. I have a whole video on how stress affects the skin, and I will link it in the description box below. I mentioned exercise. You want to stay active. Regular, moderate exercise, as your doctor approves, can improve circulation, which can boost nutrient delivery to your skin and help combat pregnancy edema or swelling. Healthy blood flow also aids to a glowing complexion. And you want to avoid toxins. I hate the word toxins, but there are definitely some established toxins out there. So pregnancy is no time for smoking or excess alcohol. This, of course, will also benefit your skin. There's also been a lot of controversy with BPAs, plastics as being like endocrine disruptors. I do think that we are seeing more and more evidence coming out with plastics affecting our hormones, and they're finding like plastics in the placenta too. One of my OBGYNs sent me an article about that. I would try to avoid using plastic containers, easier said than done. I feel like it's so rampant in our environment, but like even plastic water bottles, if you have to drink out of it, fine, but I would make sure that it's not heated. Like don't drink an old plastic water bottle that's been in your car in like a hot temperature for prolonged periods of time, or please don't heat up plastic containers in your microwave. There's established evidence that that like releases those chemicals that we don't like. What about supplements during pregnancy? Well, we know that prenatal vitamins are important with like folate, vitamin D. I do think that if you're interested in like extra like collagen support, collagen peptides are fine, but it's definitely best to discuss that with your OB. You want to focus on natural collagen support through your diet, whether it's like bone broths, legumes, if needed. By nourishing your body and your mind, you're not just keeping your skin looking young, you're building health for life, as well as like a healthy baby. And remember, the habits you set now matter for postpartum recovery and long-term aging. Putting it all together, my updated routine. So here's what my pregnancy anti-aging routine looks like now. In the morning, I cleanse gently, and then I use a vitamin C serum. And then after my vitamin C, I apply a moisturizer, ideally with niacinamide and or peptides to help with brightening and with barrier protection. And then I will apply my sunscreen. And if I go outdoors, I try to wear a hat. In the evening, I try to cleanse my face. And then 2 to 3 nights per week, I'll use like some kind of glycolic acid or leave-on lactic acid toner. Then you could apply bakuchiol or azelaic acid. I'm doing bakuchiol right now to help with my wrinkles. And then I follow that with a moisturizer with ceramides peptides. And then twice a week, I'll use like a gentle sheet mask packed with hyaluronic acid, peptides. And then of course, I like to use eye creams too. Some with peptides or antioxidants is fine. I would try to avoid eye creams with retinol. And then like once a week or so, I might do a little bit more of a gentle chemical exfoliation at home, like a 10% glycolic acid pad, usually after the first trimester. And then of course, I also religiously try to reapply sunscreen like after workouts or if I'm outside for more than 2 hours at a time. Each of these steps in a pregnancy skincare routine is backed by research or expert consensus. For example, the Journal of Clinical Aesthetic Dermatology review notes no harm from using azelaic acid in pregnancy, reference number 10. And a safety review says glycolic acid should be of no concern when used topically. These swaps keep collagen stimulating and brightening benefits in the form of vitamin C, azelaic acid, peptides, bakuchiol, while protecting my baby. Final thoughts. So pregnancy doesn't mean that you must abandon all skincare. It just means that you care twice as much and you just have to be a little bit more diligent. By choosing safe, effective ingredients now, you can protect your skin and set up better aging long-term. And every time you reach for a product, think, safe for me, safe for baby? That question alone guides you to the right choices. If you found this video helpful, please hit the like and subscribe button for more dermatologist-led skincare tips. Do you have any questions or your own pregnancy skincare hacks? I would love to hear from you. Please drop a comment below. I read every single one of them. Also, please click the link in the description box for a printable checklist of pregnancy-safe ingredients and references to the studies mentioned today. Thank you so much for watching, and here's to happy, healthy skin throughout motherhood and beyond.